Thank you again for including the PD Avengers in this conversation. My name is Larry Gifford. I was diagnosed with Parkinson's in 2017. I'm a co founder of PD Avengers. Next slide. For us, the national plan has to be about more than good intentions. We need to see whether it actually changes people's lives. Are fewer people developing Parkinson's? Are people living with Parkinson's getting better care? Is research moving faster? Those are the results we should be using to judge whether the plan is working. PD Avengers is a global patient led organization. We bring together people with Parkinson's, care partners, advocates, researchers, healthcare professionals, and organizations around the world. We listen to what the Parkinson's community says matters most. We strengthen that voice and work with partners to turn priorities into action. In 2026, we surpassed 10,000 members and 150 organizational partners in more than 100 countries. More than 700 locations in 27 countries illuminated blue on World Parkinson's Day, joining our annual campaign Spark the Night. And more than 1,500 people with Parkinson's and care partners took part in our sleep survey. Next slide. From our perspective, three things should be at the center of the national plan. First, everyone with Parkinson's should have access to reliable, high quality care, regardless of where they live, their insurance, or income. Second, we need to prevent Parkinson's where we can. That means continuing the research, but also acting on what we already know about environmental and occupational risks. Third, every major part of the plan needs someone responsible, needs enough funding, a deadline, and a way for the public to see whether progress is being made. After all, a goal without resources is just a wish. Next slide. One of the biggest problems is not that we know nothing, it's that what we know does not consistently make its way into everyday life. We know a lot about good Parkinson's care, but access still depends too much on geography, coverage, income, and who you happen to see. We are learning more about environmental risks, but there is no clear national path from evidence to prevention. Data are fragmented, and people with Parkinson's are still too often brought into research after important decisions have already been made. The national plan has an opportunity to close those gaps. Next slide. We believe two big, bold actions could make a real big difference. First, improve how Parkinson's care is measured and paid for. Medicare and Medicaid should help define what good care looks like, with people with Parkinson's and care partners helping decide what actually matters. Measuring things people experience in real life, access to rehabilitation, specialists, non motor symptoms, getting Parkinson's medications on time in the hospital, and whether people themselves say, hey, I'm getting better. Then test whether comprehensive coordinated care over time produces better outcomes. In simple terms, pay for good Parkinson's care and not just uh, a series of appointments. Second, create a national Parkinson's prevention program focused on environmental and occupational risks. Next slide. NIH, CDC, EPA, OSHA, and VA and state governments each hold pieces of the puzzle. We need to connect them. Research, environmental monitoring, workplace protections, veterans health, public health data, so that when we identify preventable risks, we can act. We need strong science, but we should not require absolute certainty before taking reasonable steps to protect people. Use the best available evidence. Match action to risk and update decisions as science improves. I know these are big challenges and it can feel daunting, but as one man once said, you know how you eat an elephant, one bite at a time. We don't have to solve everything at once, but we do have to start. So here's four things on the screen right now that we could begin with in the next year. First, create a simple public scorecard. What are the goals? Who's responsible? What's the deadline? Are we on track? Second, bring people with Parkinson's and care partners into designing better care, not just advisors, but as partners, deciding what should be measured. Third, connect health, geographic, and environmental data so we can better understand risk and track new diagnoses over time. And fourth, make participation possible for more people through compensation, translation, rural outreach, accessible technology, and flexible ways to participate. If we want the national plan to represent the whole Parkinson's community, we need to make it possible for the whole community to participate. Next slide. At the end of the day, the test of the national plan should be simple. Are fewer people developing Parkinson's? Can everyone living with Parkinson's get reliable, high-quality care? And do research and policy better reflect the priorities of people living with Parkinson's? For every major priority, we should be able to answer three questions. Who's responsible? When will it happen? How will we know that it worked? PD Avengers is ready to help mobilize the community, bring diverse voices into the process, test public-facing language, and help track progress. In the end, the plan will not be judged by what it says, it will be judged by what it changes. Thank you.